Well, COVID-19 hospitalizations are unfortunately steadily rising again as the CDC tracks a new version of the coronavirus.
The Fox Medical team's Beth Galvin has a look at the next round of COVID vaccinations.
The new COVID-19 bivalent Omicron boosters could be available by about the middle of next month. And this is coming at a time that hospitalizations are steadily increasing, and scientists at the CDC are carefully watching a new version of this virus. As summer winds down, the virus that causes COVID-19 appears to be picking up steam. The CDC no longer counts cases, but they do track hospitalizations, and they're rising.
We're lucky enough that the levels of hospitalization are nowhere even close to the peaks that we've seen before, but they've been increasing steadily over the last 3 to 4 weeks.
And Dr. Felipe Lobello, physician director for epidemiology for Kaiser Permanente, Georgia, says this virus is still spreading here in Georgia.
I'm pretty sure if there is a congregation of more than 30 people, someone in there is going to have COVID. Iris is probably the responsible variant for the most part that is driving this summer surge.
CDC scientists are also tracking a new version of the virus, BA.2.86, nicknamed Parola. It's been detected in about a handful of countries, including 3 cases here in the U.S., 1 detected through wastewater. But Dr. Lobello says Parola has about 35 mutations on its spike protein, which allows it to infect cells. And that could allow this version of the virus to get around immune protection that many Americans have from being previously infected or vaccinated.
You know, it may have a lot of genetic differences, genetic mutations, but if it doesn't have an advantage in order to overpower the current variants, it may not expand, widely enough to cause more upticks in disease. That's the hope.
At this point, the CDC says there's no sign that the new version of this virus will cause more severe illness. And Dr. Lobello is optimistic that the new Omicron bivalent boosters, which could be available by the middle of next month, will be effective against it.
The virologists that I've spoken to really think that the boosters are going to still do their job, which is to prevent severe cases of COVID and hospitalizations and deaths.
Still, Dr. Lobello says if you're 65 or older or you're in a high-risk group for complications of this virus,
I think it's a good idea to wear a mask, a good mask like an N95 over the next 2 to 3 weeks while this surge comes down, especially for the new bivalent boosters to come out.
And the new COVID-19 boosters could become available about the same time that you're thinking about getting your yearly flu shot. And the CDC says it is safe to get both vaccines on the same visit. You can even get both shots in the same arm if that's your preference. For your Fox Medical team, I'm Beth Galvin.